Welcome to the Ultimate Dental Podcast, the place where you can learn how to create a dental practice and a business life that you love. Listen in with Dr. David Moffat as he interviews successful entrepreneurs and successful business people and successful dentists as they share their business successes, their stories, and their breakthrough ideas, sharing pearls of wisdom that you can take back to your practice and implement immediately so that you can have that great practice with more patients, higher profits, and less stress. This is the podcast where great dental practices meet with successful business processes. Thanks for tuning in to the Ultimate Dental Podcast, the podcast where thought leaders, industry experts, and thriving practice owners reveal their very best tips, tools, and strategies that will help you grow your dental practice faster. Now, here's your host, Dr. David Moffat.
Hi, everybody, and welcome to today's episode of the Ultimate Dental Podcast. I'm your host, Dr. David Moffat, and I'm in Burrawang in New South Wales in Australia, where it has just gone 9:30 Friday morning. It gives me great pleasure to welcome to the studio all the way across the other side of the world in Fairfield, Connecticut, which is 40 miles from New York City. Is that right, Mike?
That's exactly true.
Yep. Dr. Mike Sonick, who is a periodontist and also a lecturer. Now, Mike, I'll frame this up right from the start because I found your information and found it very, very interesting on LinkedIn. Not so much the periodontal side, but the fact that you like to teach dentists about customer service, which was my passion in my practicing life. We've had a chat for half an hour, and I've told you that, I had my own practice for 28 years, and that was in a working class part of Sydney where you would expect that people were price conscious, yet I was able to build a very successful, profitable business that I stayed in for 28 years. That's a generation and a half of people. People who were school children were bringing their school children towards the end of my time there. So tell me about your story in dentistry, how you decided to become a periodontist, because that's still a mystery to me why anyone does. But I know that, becoming a dentist was a difficult decision for me, and then specializing I just thought was going to narrow it down too much. But I'd like to hear your story and also how you got bitten by the customer service bug, because that's really what happens, isn't it? Once you get passionate about customer service, it engulfs everything that you do in business and in your life, and it makes life so much more pleasant when you can be pleasant and you can expect those pleasantries from people. So, Mike Sonick, welcome, and thanks for joining me.
Pleasure. That's a question that I can go on for hours, but I won't do that. And I think, first of all, I had a really bad bike accident when I was 8. So I was in the neighborhood, and I was on I borrowed my friend's bike, Paul Balsano. And I was biking in the neighborhood, and Paul's dog, Tippy, jumped on me. And as I was biking, and I went over to handlebars, and I landed on my face. And I knocked out my front 2 central incisors that ended up on the sidewalk. They were shattered. And it was right in front of my house. And so my mom saw it. She came running out. I didn't know it at the time, but it was a pretty hard thing for a mom to see their 8-year-old break their jaw. So they took me to an oral surgeon in Bridgeport, Connecticut, which is where I live, which is one of the worst cities in the United States. It's where I grew up, and it's a poor city. It's a working class city. It was a great city at one time. The P.T. Barnum is from there. I don't know if you know P.T. Barnum.
Yeah, I do.
The great showman. Anyway, I was just talking to my staff about that, my team today, and a lot of them didn't know P.T. Barnum, even though we're right there, because, it was in the past, and a lot of people don't always know about the past. But anyway, jaw was wired shut for 8 weeks. I saw an endodontist. In 1960, this happened in 1961. There were only 2 endodontists in the state of Connecticut, which was a state of 2 million people. So there were none. And I saw this guy, and I don't know why it took like 5 or 6 visits, but it did to the endo. And those 2 teeth stayed in my mouth. And I'm 73 now. One of them's still there. And so that happened when I was 8. So do the math. That's a long time. Over 60 years, I've had 1 tooth endodontically treated. The other one I lost in my 40s because it decayed. And so I went through high school without 2 front teeth, 2 little brown stubs. Back in the 60s, they weren't doing crowns. And they said you had to stop growing before you had crowns. It was before implants. And I had my 2 front teeth crowned when I was 18. So from the age of 8 to 18, I didn't have front teeth. And, I get made fun of, but I was okay with it. It didn't bother me. It's just, that's the way I looked. I didn't really think much about it. And so, my area of expertise now, I'm very well known in periodontal and implant circles as a guy who does anterior aesthetics and single front teeth. I do probably 1 or 2 a day. I've written my new book is Treating People, Not Patients, which is about customer service, which comes on after that. But my early books were all about implant site development, bone grafting. I've written 7 books, including my book on customer service, published 70 articles, and I lectured all national meetings, including Australia. I've been at the Australian Implant Society in Sydney a few years ago, and as well as New Zealand and Auckland. So I always want to be a good clinician because that's what I was taught. And, I was always sort of pushed by my parents to be a doctor. I really didn't want to be. I'm a performer. I was an actor, musician. I played cocktail piano. I wanted to be an entertainer, and that's why I teach, because I like to talk. I never turn down an opportunity to lecture. A lot of lecturers say, hey, what am I going to, I just will go because I just enjoy it. For me, it's my passion. And as I went through my life, graduated high school, I worked as a lifeguard from the age of 16. My father had a furniture store. He was an engineer, but he also had a furniture store on the side. So I delivered furniture, I refinished things, so I got good with my hands, and I delivered it and set it up and talked to people. And I loved lifeguarding because I got to fix people's, injuries on the beach. And then for some reason, I don't know why, I was drawn to restaurants. In college, I started working in restaurants in the summer. I went to resort towns. I went to a town called Kennebunkport, which you may have heard of. That's where George Bush had his place, and I worked in restaurants there. I ended up playing cocktail piano in a restaurant I worked at. The Saratoga Springs, which is a big racing town. I worked in there. And I learned from other people. I had to uncork a bottle of wine, how to say hello. And I enjoyed the experience. And I learned about food. And I became someone who was not only interested in it, but I became a short order cook. In college and in dental school, I took in boarders, paid me $15 a week for 5 meals. And so I would take them in, but I wouldn't clean. I do all the cooking and all the shopping, and I loved it. I loved the opportunity of serving people, and I loved getting served. So I was just attracted to that business. And, so it was another long story. I worked in many different offices. I worked in 20 different offices before I opened up my own office. I worked as a general dentist. I worked in Harlem. I worked for a phenomenal dentist, Myron Finkel, and I'll talk to you about his story about Showtime if you want in a second. And he taught me all about, you're a performer. When you are working in a dental office, he says, Mike, and every day he would say, it's showtime. He says, you come to work. He goes, you're putting on a show for the patients. It's not about you. And you have to get out of yourself and be nobody cares about you, you tell me, Mike. He goes, we come to the office, like we were talking about P.T. Barnum today, Hugh Jackman who played P.T. Barnum. If you go to Broadway show and Hugh Jackman shows up, he says to the audience, he goes, I was out drinking late last night. I pulled my Achilles tendon. And my jaw is really sore. I'm not going to sing. I'm just going to mouth the words. I'm going to walk through the performance. It'll be the same performance, but I'm just not going to put any energy into it. And you flew in there from Australia or Ohio or Florida, and this is what you've been looking forward to. And then the guy who's putting on a show doesn't do it. Well, that's what we do in dentistry. That nobody wants to hear about my personal problems, or if my kid's in trouble, or if I have financial problems, or my hand hurts, or I didn't get a good night's sleep. I'm always on top of my game. And that's what I learned from Myron. And every day we'd walk in the office. And Myron was a very cool character. This was as a general dentist I worked before I was a periodontist. We worked in this townhouse on the Upper East Side of New York, which is a very Tony neighborhood. Our neighbors were Richard Nixon, who lived in a townhouse next door, Mary Tyler Moore, the actress, Arthur Schlesinger, all these famous people lived there. And his patients were all like Broadway people and mobsters, because he grew up in Red Hook, Brooklyn, which was a really tough part of town. And Myron he's like 5'6", but he has this huge personality. He graduated #1 in his dental class at NYU, and he was great with people. And he walked in the office with a German Shepherd into this townhouse with red carpet and white wicker furniture and fresh fruit. By the way, it was 1979. And a bottle of chilled wine. And he'd go like this, Mike, snap his finger, showtime. We start every day. It's showtime. And he taught me how to be there for the patients. And that was after I worked in the hospitality industry. And I think it all sort of moved together and connecting with people. And it was fun. And that's how I built my practice, by being there for the patients, never talking about myself, being present, which is the most important thing you can be, and connecting. And I've done that for my whole career as I was trying to become a really good implant surgeon and a good periodontist, which you said you don't know why I'd become a periodontist. And that's another story. But I wanted to be really good at one thing. But, when I graduated my residency in 1983, there were no implants, there were no connective tissue grafts, there were no bone grafts. All the things that we're doing today weren't around. And I thought it would be pretty straightforward and easy. And I'll tell you, I like cleaning. So like if I came to your house, David, and it's a mess, I would not mind going into your closet, organizing it, cleaning it, getting down on my hands and knees. I happen to love that. So I just love keeping things neat and clean. My sock drawer is organized. My spices are done alphabetized. When I had CDs, they were not only alphabetized, but they're by genre. And so in my office, I'm one of the people that always is very clean. And I have pictures of myself and videos when I was like, actually that video is Super 8 movies, when I was like 5, cleaning the closets. My sister was 3, was pulling the sheets down and putting them back. And to this day, that's what I want to do. So I think that's probably why I became a periodontist. So, I mean, it's like, I've just given you like a whole host of reasons. Because how do you, Dave, why did you end up doing what you're doing? You have no idea. I mean, it wasn't like you planned on doing podcasts like 40 years ago. You got to look in the rearview mirror to figure out why you're here. So as I look in the rearview mirror, bike accident at 8, not something I wanted, going through high school with no front teeth, working in my parents' furniture store, lifeguarding on the beach. My mom was not the great cook, so I was attracted to food. I wanted to learn how to cook. So I went to the restaurant business. I learned how to serve people. I learned how to cook. I learned how to mix drinks. I always played the piano. I love music. I play there. And then I meet Myron, and he teaches me about Showtime. But I'm sort of an actor anyway, because I was a high school actor and I do improv and all those things. So I was just like, it all came together. And so I became a dentist. It's not like I wanted to like cut people and suture them. And I love that. It's not what it is. I mean, I'm good at it, but that's not what I love. What I wanted to do was take my job, which happened to be a dentist, and turn it into a Broadway show where I can give the best service possible to patients by getting out of myself and helping others. That's the greatest gift I can give, but it comes back fourfold. And so today, after 42 years in practice, I got a kick-ass practice. I mean, I didn't do it to make money, but I make money. But now it's just like, how can I, my greatest gift I can do, like I did today, I had a retired dentist come in and she wanted all this gum grafting. And I looked at her, I go, you don't need anything, you're fine. She goes, I need this, I want the pinhole technique. I said, I'm telling you, you don't need anything. And she goes, I don't. And she wanted me to do something. I said, no, you don't. And this visit's on me. Leave. And go back to your retired life. Do what you're doing now. And I felt really good. She felt good about it too. Because I could have told her she needed something. She would have done it. But that's not really was the right thing to do. So I love doing that. And I know I was a little all over the place, but that's sort of a little bit about my background and why I do what I do. And, I just love to teach and help others.
Well, Mike, I'm glad that was the short answer, but you've covered so much ground, and it tells people a lot about you. And
you asked me a tough question. Why did you become a dentist?
Yeah, I thought I asked a long question, but you gave me an even longer answer. But that's the exciting part. And I figured, reading from your website and your LinkedIn bio before we met this morning, my time, was that we did have a few things in common. I still have all my teeth. I've only got a DMFT of 4, no extractions at age 66. But my parents were both working class. My father was in the Air Force as an electrician. Then he became a salesman when he left the Air Force. He left the Air Force because he didn't want my mother to have to be an Air Force officer's wife, because he saw on base they were just dragged from location to location. And so my mother was a nurse, and then she became a teacher while I was at school. And then my dad went back into school and got a degree in English literature. But I also worked a part-time job. I worked in a news agency, which a lot of young people wouldn't know what they are. They sell newspapers, which a lot of young people don't know what those are, and the books and stationery. And then I left that and worked in a bar, in a return services club for 2 years, and did tray service and bar service. And that's where I really learnt my customer service skills, because I learnt that if I was able to keep people's drinks topped up and serve them quickly and keep their tables clean, I would get tips. And to me, that was a fair exchange for my efforts. Now, you did also mention about Myron and that phrase about it's showtime.
Right.
And I love that, because a periodontist, and I have had another periodontist on my podcast, the late Robert Pick from Chicago.
Yeah. Right.
And it was his phrase. He
he taught me two things. Bob and I became very good friends. I never got to meet him, but I spoke to him often, maybe once or twice a month. And
Really?
he used to call me his brother from another mother. He identified that the service that I was doing was exactly what he was doing, and he used that same phrase. It's showtime. But the other thing that he always said was excellence and ethics always. And it's something that I use to teach my clients. You have to be a great dentist, and everything else then backs that up. But if you're a great dentist without the customer service, nobody knows how good you are, and then they'll just judge you on price, because you've seen it in your career. I've seen it in my career. People who walk in and their mouth looks like a bomb's gone off in there, and they say, "Oh, my dentist, he was wonderful." And you say, "He must have been wonderful. Look at how he got this work to stay there." It's horrid. But that excellence that we practice, that we teach ourselves, is our insurance to ourselves, that we can then charge the prices that we deserve for the service that we give, which is the differentiator. And that's what makes dentistry such an opportunity for good dentists who see that, the public don't really get a good experience when they go to the dentist. And so if you can be different, like Myron was, like you are, then you will have people travel from all parts of the country to see you. And I think, that's, again, what attracted me to your story, was that you were teaching this as a periodontist. I'm only joking about periodontist. In fact, my wife's car, we bought it secondhand from a periodontist who had it for 4 years. It was identical to mine. Mine's brand new. They're the same year, but he said, "I'm selling mine." And I said, "I'll buy it," because I know it was just driven to church on Sundays, really, hardly at all. And the only difference was that he was a bit bigger than my wife, so there was a bigger dent in the seat. But with time, it's been fine. We've still got that same car. So anyway, let's get back to you and talking about some of the things that you have written about as well. You're very passionate about helping dentists with their systems and making sure that they don't become micromanagers, that they do become customer focused. I love that. As a periodontist, I didn't think you would get this, but you have actually written an article about patients who come in and say, "I just want a cleaning." Tell me how you manage that.
Well, first of all, it's hard to you can't schedule cleaning in my office. So every new patient has to come in and see me. And I started my practice that way. I started practice in 1985. It was a white box, it was 650 square feet with nothing in it. I gutted it, built it, and I opened up a practice I was the sixth periodontist in town. The town is my hometown, but it was only 65,000 people. So it was already, people said, "Don't open up. We don't need another periodontist." But I decided I'd open up where I wanted to be. And when you go to certain communities and you want to go to a florist, or like in New York City, there's one street where all the diamonds are sold, one street where all the florists are. And sometimes restaurants, one street where all the good restaurants are. And it's like, they're all making it. I figured I can make it if they're making it. It may take me a little while. So I opened up that white box, and I decided I was just going to give good customer service and not take insurance and wait for the growth. And so when patients wanted to do something that I didn't think was aligned with the way I practice, I try to have to re-educate them. And that's scary for a lot of dentists. A lot of dentists, Dave, here's the thing. A lot of dentists, they do what they think the patient will buy. And that's not always what they need and what's always in their best interest. And there's a line I have. Sometimes we'll say to a patient, I said, "I have to save you from yourself." I said, "Because if I treated you the way you wanted me to treat you, I'd be giving you substandard care." So what I do in our practices, it's not a sales practice, it's an education practice. Education is the cornerstone of what we do. So I look at myself as a clinician and an educator. So when people say that, they think I'm a teacher because I teach at universities and teach, I've been teaching since I got out of my residency. I've been teaching, and I like that. But most of my teaching, the most important teaching, happens in the office with my patients, and it requires education. It's actually one of our 5 core values is education. And so everybody on my team has to, or is required to, educate our patients. And when they say, "I just want a cleaning," we'd love to do that for you, but we find it works better if we examine you first, because I don't know if you need a cleaning or not, because I've never seen you. So to do treatment without an exam, in my opinion, is a disservice to the patient, and it borders on malpractice. 80% of my patients come to see me after they've been seeing dentists for years. Some of them maybe took a 4-year break. Some of them had been going to the same dentist, and their mouth is not in very good shape because patient tooth hurts, we take it out. Patient doesn't know if you take out a tooth without replacing it, that the back molar is going to move, or that they're going to have to need ortho if they're going to realign it, or if they don't do a bone graft, they're not going to be able to do an implant. There are other options. And I see patients every day. I can go on and on and on about all the things that I see. And it really saddens me because I was trained at my university. I was trained by Harold Lowe, who is the most important periodontist to exist, because he was the first periodontist to say, if you don't brush your teeth, your gums are going to bleed. And this is why, because he cultured the people. And he did a very famous story. It's called Experimental Gingivitis in Man in 1965. He published it. It took 21 students and took their toothbrushes away. They're dental students. You could do that back in the 60s. And he cultured them. And within 8 days, 21 out of 21 were bleeding, and all their bacteria went from gram-positive to gram-negative anaerobes. And then they gave them the toothbrush back, and 7 days later, they weren't bleeding, and they're back to gram-positive cocci. That's what the article he published. And he was my dean. And he says, you are physicians of the oral cavity. You need to do everything that the patient needs to get their mouth in good shape. You have to do a comprehensive examination, which most dentists don't do. Only about 10% do. And when I say comprehensive exam, I'm talking about x-rays, models, perioprobing, caries exam, occlusal exam, aesthetic exam, photographs, cone beam CT scan, complete set of x-rays. Most people don't do that because they don't have time if they come for cleaning. You get to say hi and bye, and you go, oh, let's do that one tooth. And there's a one tooth practice. If you build your practice on a one tooth practice, you're just trying to fill your book and you're not treating patients well. And who wants to go to a dentist that just had one bad experience? When you tell a patient, as I do for every new patient, and your listeners should probably be aware of this, I tell them, I said, if you don't commit to taking care of your mouth for the rest of your life by getting your teeth cleaned every 3, 4, 5, or 6 months, I said, I can't treat you, because it's sort of like driving the car into the ground. You know, that car that you bought from the periodontist, it's like, if you don't take care of it, it's not going to last very long. So education is how we do that. And it's hard. And my daughter's a dentist, and she just bought a practice 2 weeks ago. And she bought a practice from a dentist that treated that way. He was burnt out. He's 55. He wasn't taking x-rays. He wasn't doing perioprobings. And all she sees is disease. And she's got to educate 500 patients to do dentistry the right way. And it's her challenge. And I said, be patient. You can't tell them the first day. She goes, I can't believe it. I said, it's good. You'll treat these patients and you'll convert them. Dave, I have never met a patient that didn't want to do the best treatment for themselves. I've never met a patient that says, no, give me some standard of care. Ignore my tumor. Ignore my periodontal disease. Let the bone loss. I don't care about the caries. Tooth needs a root canal. Just take it out and let everything collapse. They don't do that. I said to a patient today, I said, let me ask you something. She had been to 2 different dentists. She stopped seeing a dentist for a few years. She's had 2 extractions in the last 6 months. She had a bridge of calculus on mandibular anterior teeth. She could not close her mouth because she fell, and she's been like that for 2 months. I felt very badly for her. She wasn't educated. She wasn't that knowledgeable. She wasn't a wealthy patient, and she never had this conversation. And I talked to her just like I'm talking to you now, and I told her what we would do. I said, but I don't know what I could do for you. First, I got to get you out of pain. Let me do that. Let me get the endodontist involved. Let me get the facial pain person involved. Let me diagnose you. I said, you need a lot of other things, but I'm not really worried about now. I'm going to get you out of pain. At the end of that visit, she did whatever I asked her to do, and money was not an object. And the first thing she said to me, she goes, the reason I'm like this is I ran out of insurance. Well, insurance doesn't pay for that. And she was just abused, I call them, my patients have PTSD, post-traumatic dental trauma. It's really sad. And I don't know why dentists do it. I do know why dentists do it. I'll tell you the reason. It's fear. They're afraid that the patient's going to say no, so they choose what the patients will say yes to, because then they think that they could fill their book that way. It's quite actually the opposite. By telling the patients the truth, and as we were talking about earlier about having integrity, patients will usually do the right thing. And it's a skill set, you have to learn to do that. It's really, really important. And I always say, if you practice with integrity, you have a niche practice.
Absolutely right. And I was very lucky to learn that in my own practice at an early start. I bought my office in 1987, and it was doing $10,000 a month. And then just after I bought it, health insurance companies were given the license to own dental practices, and 2 of them were setting up as competition. And all the dentists in town, and there was 40 something of them, was saying, oh, this will be the end of us. They're going to take all our patients. And I learned that what they actually took was the patients who were price conscious and not health conscious. Right. And so they took all the patients that if you got to choose whether you wanted to keep them or not, they took those ones and it made practicing dentistry much better because the people who were coming were paying fee for service and insurance wasn't covering it all. Dentists who say, I worked for a dentist for 3 years before I bought my office, and he used to go through the insurance rebates every year. And he says, we can make some money if we do more of these fillings, class 5 glass ionomers. I'm going, I haven't become a dentist to do class 5 glass ionomers my whole life. It's fascinating. So what you said about where you are now is because of where you've come from, not where you decided to. And so that decision of mine to, let's see how this goes when they take all those patients. Well, they took the ones that I didn't want and probably helped me to determine that there is opportunity even in a low socioeconomic town for people who still want to pay for their health. And that was really, really important. I want to go back to something that you said in the intro about you being a compulsive cleaner as well. You enjoyed cleaning. And it's interesting because my wife and I were having this discussion in our home just this week. And she says, she has she has friends who say, I've got to do a deep clean on my kitchen. And she goes, well, don't you just clean your kitchen every night so that it is spotless?
Yeah.
And that's what our place is like. People come to our home and they say, who's your cleaner? I say, well, it's actually my wife. And she says, there's no point in me employing someone. They never clean it as well as I do. But she's always cleaning as she goes, a little bit every day to be on top of that. And so being organized and being of that mindset, as we're talking about customer service, cleanliness is also a factor that you can't unsee filth, or laziness in terms of cleanings. It's interesting that you have that cleaning bug as well as the customer service bug as well.
You can learn that too. I think it's important. Cleanliness is important for a lot of reasons, but I talk about where you were talking about the importance of doing good clinical care and having good service. There's another part there. It's having really good decor. And when I say decor, it's the experience that you don't even know you're seeing. Like it's what I call it neuro-linguistic programming because, when I have a conversation with somebody, like I'm looking at you here, we're not in person, but I see how you're dressed, I see how your hair looks. I mean, it's clean, it's neat, you shaved, those things, they come off, if you came in here and you had stubble on it. I just finished a full day in the office, but I showered before I got on here and I shaved, even though it's 6:15 my time and, I don't need to shave at this time, but this is the only impression I'm going to get online. So the cleanliness is really my patients seeing a very clean office. I mean, I don't do it just for that, but it's like the cleanest office they've ever seen. And whether you want to be clean or not, I mean, I don't think it's that hard to take a shower, to cut your fingernails, and to put on clean clothes, wax the floor, etc. And you don't have to do it, but if you don't like to clean, I happen to like it. But if you don't like it, hire people to do it and surround yourself. I don't like everything about practice. I mean, there's how many things are there, Dave, for running practice, I mean, the vendors, the hiring, the insurance, the phone, physical facility, the clinical stuff, dealing with the problems that come every day in the practice. It's nonstop. And, I don't like all of those things, but some of them I love. I love dealing with people and having problems. I enjoy that. Most doctors don't. I love making sure everything runs smoothly. I like the systems, I don't make phone calls. I hate that. I hate making phone calls. So I don't make many phone calls at all. I have systems where I can communicate, but I don't want to have small talk. It's wasted my time. I want everything that I do to be intentional. And most of the time, if I talk to dentists, they'll talk to me about whatever they want to talk about. But I'm there just to talk about the dentistry. I'm not friends with every person I talk with. I'm there to do a job and to give them a good experience. So I don't want people to get in the way of that. So there's certain things like I have 2 3D printers in my office. I have never watched the model be printed. I had a patient in today. He's a computer programmer and he's nervous as hell. He's on about 4 different psychotropic medications. I'm related to him. And by the time I'm done, he is so excited that I have a 3D printer. I go, would you like to see it? He needs a single tooth implant. He goes, could I? He goes, let's check with Jason now. He's our lab guy. Because we have 2 models printing now. He ran into the basement to our laboratory and he watched that. And he had a great experience because he watched the 3D printer. And I turned to him, I go, you know something? I've had 3D printers here for 4 years. I've never watched a model printed because I just don't care. I don't care about the technology. I just want to use it. Some people love to use it. I don't. I just want to be able to have the facility to use it. So it's interesting. There are certain things that you need. You have to have good clinical skills. And you have to give patients a good experience. You have to clean the neat office. You have to have a good team. If you don't know how to do all that, find someone that can do some of that stuff. If you're going to do the clinical dentistry, you got to be pretty good at it, or hire dentists to work for you. Some dentists do that. Maybe you like to run the business. I started off, liking people, but I also wanted to be a really good clinician. And now I'm 73. I've gotten to be a good clinician. I've been doing this for 40 years. I should be good by now if I care. So that doesn't excite me so much. I've done 17,000 implants. Doing an implant tomorrow is not a big deal to me. But you know who's a big deal too? That patient is in my chair. Okay. I may have done it 17,000 times. They're doing it once. And so for them, it's the biggest day of their life. I have 2 stents in my heart that were put in 6 years ago. One of my left coronary artery was 90% blocked. They said it's okay, but I went 5, 6 different cardiologists. And I found one say, I'd like to open it. It was. Now, when I went in, the guy who did it, I knew him well. He had been doing it for 35 years. I was just someone that just put a little tube in a tube. But for me, am I going to die today? Scary. That's how I know my patients think that. Am I going to die today? Is he going to cut me? Am I going to be in pain? Does he know what he's doing? Is he in a good mood? Did he fight with his wife? Is he doing it for the money? Yeah, I know he did a great job, my sister, but this is me today, So all those things go through our patients' heads.
It's interesting how you talk about that because, and you mentioned this earlier, that, when you started off as a periodontist, there wasn't any implants. It wasn't any bone grafting. It was just gums only. And Howard Ferran said to me a long time ago, he said, practice management, he said, you could be giving a talk in a hotel and there might be 20 people there. And then down the road, some guy's giving a talk on bone grafting and there's 2,000 people there in his audience and they don't do anything with it. And the practice management is important because that's really how they keep their business alive, 100%. The skills that they'll learn from that. And I love that he picked the words bone grafting because when those words came into my dental practicing career, they scared the heck out of me. In terms of bone grafting. You'd said you've done 17,000 implants. I reckon I did 17 before I decided I can do other things quicker and better that are much more enjoyable than having to set up to do an implant.
I got my book
and
here.
So I got somebody else in to do my implants.
There you go. You want to see something scary? Here's my textbook, Implant Site Development, right? And there's the cover I put on there. All surgery and pictures and graphs and stuff. This is what I do. This is what dentists do. Oh, you wrote that book. All right. Yeah, I wrote that book. Well, a lot of people have written books on that. That's important. Yeah, it's important, but no one's teaching customer service. No one's teaching hospitality. Forget getting people to say yes and making more money. What you also do is you give people better experience. They heal better. There's less pain. It's just, it goes so much further than selling dentistry. Selling dentistry is just giving really high value. One of my friends says, I want the value I give to be greater than the money I receive. I want the value I give to be greater than the money I receive. So what does that mean? It's like, I don't think about money. I just love giving value. And guess what? The money follows. They got to think about the money, but I don't lead with it. It's just one thing. Besides money, there's time, there's pain, there's suffering, there's prognosis, trust. A lot of the things come into, selling dentistry. It's not money. You lead with money, you'll never do much dentistry. And you'll do bad dentistry.
Oh, for sure. It's
adding
that.
Yeah.
It's adding that value that keeps people coming back. My huddle was always looking at not what were we doing, but who was coming in and what was their backstory. My huddle was all about backstories. And unfortunately, because I've been there the longest, I knew all these people. So I had to tell the same stories to different team members across the years. But one patient, Russell, he was in the time that I treated him, he had 3 different jobs. He was a storeman, he was a postman, and he was a garbo. He was a garbage man. And he kept coming every 6 months, and he had probably 8 porcelain crowns, single tooth dentistry, but 8 porcelain crowns. And I used to say, oh, Russell's in today. I said, find out why Russell keeps coming, and whatever we're doing for Russell, that's what we've got to be doing for everybody, because he is not our avatar. He's not our typical avatar of our, the ideal patient, but we're hitting a note with him that he comes for the connection, because we take time and we listen to him. And that was really, really important. And so I think you've written about it. What's the title of your latest book?
Treating people, not patients.
Exactly. And everybody's got a story and everybody wants to be listened to. I had one patient her husband was a veteran, and when he died down here, the widow gets the dental services then. And so she's entitled to 2 porcelain crowns per year under the dental allowance that she gets. And so I said, you can tell how long she's been a widow because you just add up the crowns in her mouth and divide it by 2, and that's how many years. She never spent money on her teeth. Her husband was her priority. But if you say to her, how long have you been a widow? She'll burst into tears 8 years afterwards. And so it's about the stories and the relationships and having those things. They're far more valuable than the money, I think, in fact, after I left my office after 28 years, I had my shoulder replaced, and then I started working for a friend, and then the arthritis hit my hands. And one of my patients followed me, and he had had this interaction with my wife on the reception where he said, I think I've paid for your children's education. And my wife just straight out said, and we're very grateful for you doing that. So when he turns up at this new office, he says to the hygienist, he says, I paid for David's children's education. And I said to him, Tom, if I'd have known you were going to follow me up here, I'd have had more children. And so that was the relationship we had, a little bit of a poke fun with people. But again, it's those stories rather than I went to university with a chap who became an endodontist. He was taking photographs of his radiographs of root canals as a student. And I thought there was something, he had a kangaroo loose in the top paddock, as we say down here. He was
Kangaroo
very proud
loose where?
in the top paddock.
In the top paddock.
In paddock.
All right.
Paddock.
Okay, I'm learning a lot.
Them?
Heard about Garber, which I never heard of a Garber before.
A garbo. In Australia, we talk that way. Everything is abbreviated. So you coming over to my place on Sunday, Arvo, for a barbie. That means you're coming on Sunday afternoon for a barbecue. All right. And you bring your esky, which is, you call them an ice box, but that's actually the name down here. It's a brand name. Everything's abbreviated. Even names are abbreviated. My sister married, her husband is Bill, abbreviated from William. Her son is Rawes, abbreviated from Rory. And her other son is Lockie, abbreviated from Lachlan. She's Libby, abbreviated from Elizabeth. It's an Australian disease to shorten things.
Yeah, I try to learn these English expressions and Australian expressions. My wife loves them. I mean, I was traveling with this policeman from, what is the place furthest west?
Perth.
Yeah, Perth. And he said to me, he goes, Mike, you're funny. I'm going to take the piss out of you. And I didn't understand what that meant. I was trying to figure it out. It took me like 6 months to figure that out. And then I realized that people made fun of people from Adelaide. So I was on a bus with a bunch of people from Adelaide. I go, do you get any respect in Australia? And they were looking at me like, what are you talking about? And then I went over to Kangaroo Island, and there were no kangaroos there. It was it's a whole different way of looking at it. My wife says to me, if she was going to move anywhere besides the United States, it'd be Australia. She loves it.
It's a big place, and you're right about Adelaide. Down here, we say it differently. We call it delayed because they're so backward.
Delayed. Okay.
That's how people from Sydney say it. And also you have this Sydney-Melbourne rivalry, which is, Melbourne's like the little dog and Sydney's the big dog.
Yeah.
And Melbourne's, they've got more culture and maybe they have better restaurants. Probably they do, but they preserve their history as well. But,
Melbourne,
they don't have a harbour.
We drove from Sydney to Melbourne thinking it was like a short drive. And first of all, it's on the wrong side of the road. There aren't many gas stations. We almost didn't make it. It took forever. I thought I was just driving like an hour. It was longer than that.
It's I live 2 hours out of Sydney, and we actually drive to Melbourne rather than fly because we've got to drive 2 hours to Sydney and then got to wait in an airport, get on the plane. We're already in Victoria by the time the plane would have arrived in Melbourne, and then we've got a car. So that's just how we do it. But there's not much there. There's not much to see. It's not scenic. And I think the New England area of North America is far nicer than the New England area of Australia.
And see, it's beautiful. Well, that's where I live. I live in the part of New England that's close to New York. So we call this New York with trees, pretty much is what we say about this place. So, but it's
there's a lot of people there. I love what you said, how you said to patients, if I treated you the way that you wanted me to treat you, I'd be giving you substandard care. I love that. I've actually timestamped that because I think that is such a valuable statement that all dentists need to learn to use. I know I did it with patients would come and say, can't you just put a filling in it? And I say, no. I said, the margin is so subgingival, the only way I can get a restoration that's going to last is an indirect restoration, either a crown or an inlay. And that's going to cost you more, but you'll get to keep your tooth. So here's a temporary filling material. Come back when you can afford the treatment, because a filling, an amalgam, a composite is going to rot, and then we got less tooth. And but a lot of dentists are afraid to use that sort of harsh reality term, and then they're forever making excuses for why the thing's failed because they've set it up for failure.
Yeah, it's an informed consent is what you're doing. And then the patient will make their decision. I have a whole algorithm where I take people through. In dental school, we learned that we have to do an exam, and then diagnosis, and then treatment plan and treatment. And most dentists don't. They walk in the room and they go, oh, schedule them for a crown. That's a denture. Oh, that's an implant. They don't take the patient through it. And I think once you take a patient through the exam and diagnosis, you have those treatment options. And then I explain each treatment option to the patient so they can make their decision. Then once they make the decision based upon the cost, the risk, and the benefit, then we do the treatment. I mean, I actually have like a whole flow sheet for the patient in my head. I mean, I'll put it out for them, but sometimes I do. When a patient comes, like the patient I saw today who was missing all those teeth and was in pain and needed endo and the bite was off. I didn't know exactly what was going on yet. I called my partner and he wasn't sure. He said, I just got to get you out of pain first. Get you out of pain. And then I control the infection. And then we work on function, aesthetics, and maintenance. So I took her through there. I said, so right now, just make a cleaning with me. I haven't been cleaning in a few years, and let's get you out of pain at the endodontist. And then I can figure out about your bite. It made sense. It made sense. If I meet with a lawyer or an investment person or somebody outside of my field of expertise, are they making sense or not? Is it simple? Not. I'm a simplifier. I mean, when a cardiologist says to me, I don't have to look at that x-ray because I don't have to understand it. He does. I'm thinking like, you're marginalizing me and you're talking down to me. I'm losing confidence. When my investment advisor says, this is a little too sophisticated for you to understand, I realize you're not the right person for me. When a dentist says, I know what I'm doing, do this, you're talking down to the patient. And most of the time, you're not giving the right information so they can make the right decision. That's the way I think about things. And it always works. My case acceptance rate, I'll give you good listeners some. When I first started in practice, I started in 1985. I think you said you were doing $10,000 a month. You bought practice. My first year in practice, my first month, I did $20. Okay, because I started scratch. $20 my first month. I started January 1st, 1985. At the end of the year, I took in $35,000 for 12 months. My overhead was 90. Year two, I went from 35 to 90. I still wasn't making a profit. Year three, I did 125. And how did I support that? Well, I worked in a mall 2 or 3 days a week just to make money to support my practice. Because I had to I created an ideal. So if your listeners want to figure out, I want to do something, create the vision, and then just create that vision, and then you do the little steps to get there, and you have to stay true to yourself to get there. So I had a vision of having an ideal practice. That was, it took me a few years, and then, in my town where I said I had 6 periodontists, there's only 1 or 2 now. They all left. So I'm pretty much the game in town. I'm actually the game in Southern Connecticut. I get patients from all over. I'm booked 4 months in advance. I produce over $15,000 a day, and I have a 92% case acceptance, which my advisors tell me is too high, because my fees are too low, he say, but I'm comfortable with my fees. My partners have an 80% case acceptance. My younger partner is booked 2 months in advance. Been with me for 12 years, and he never took insurance. And my younger woman from Australia is just starting to get busy because it takes a year or two to get busy in our practice. I'm not going to fill a schedule with small procedures. You need to build relationships. Today, she drove around to 25 different dental offices and dropped off a 2-pound box of See's candies just to talk and say hello, which is for Valentine's Day, because nobody gives the Valentine's Day gifts, they give Christmas gifts. So it's a little distinguishing thing. Now, that we didn't build our practice by giving gifts. We built it otherwise, but it's just a nice gesture. So I think it can be built, but it does take a little bit of time. And then I can sleep at night. I don't have to worry about, did I do the right thing or didn't do the right thing? Here's another line I use, Dave. I tell patients, I said, I don't care if you go through treatment or not. And they look at me like, what the hell? And I also say, you don't have to do anything. Because I tell them I give them a treatment plan. It's usually 3 things. I don't give them more than 3 because it's confusing. I can give them 1,000 treatment plans. The first option I always give them is to do nothing. And what that does is it forces them to make a decision, because if they're in your office, they don't want to do nothing. They go, no, I got to do something. I go, well, here are your options. And I go through that. He said, but I don't care what you do. I don't care if you go through treatment or not. I go, what I do care about is that you understand what your options are and you're educated so that you can make the best decision for yourself. So what I do is it's called a collaborative treatment model. It was developed in the 70s by a guy named Bob Barkley. That's the way I was treated. Then I found Bob Barkley, and most people don't know who he is. And I found his philosophy, his books, and his writings. So I talk about Bob Barkley because I really respect the mentors, although I sort of figured that one out on my own. And it's just a good sales practice. Tell them they don't have to do anything, give them value, let them make a decision. And by doing that, they usually make a decision to do treatment. 92% of my patients make a decision to do something. And the other 8%, I don't know what they do. They usually come back. They're not going anywhere else. They're going to do nothing. And let's say money's an option. That's a big issue. What do I do when patients say, well, it's too expensive? I do what you do. We'll put a temporary filling in and we'll do a crown, or we just do the scaling this year. We slowly build you back. I developed this. I show them this curve. I go, here you are at the bottom of the curve. You want to get back up to the top. We may go there in 6 months, but if you want to take 5, 6, 7 years, we could do that too. You had a patient named Russell you mentioned to me. You want to know what you did? I had a patient named Russell. His name was Russell Kroll. He was my patient for 34 years. He died after 34 years, but he never missed a prophy. Every 3 months he came in. He was a carpenter. He didn't have any money. I did 1 quadrant a year for 5, and it was actually I did about sextant. And then he did 1 implant. He did 4 quadrants of periodontal treatment. And that was back in the 80s, and he had no dentistry done for 25, 30 years, except for cleanings, because he was committed. And I talk about the Russell Kroll story all the time. He's actually on my website. There's a video of him talking about what it was like, because he was scared he was going to lose his teeth. A lot of our patients are scared. I mean, why do patients don't go to dentists? It's not money. It's fear. It's fear. And the most important ingredient, I have a book here somewhere. This one here. Got a lot of books. But this is what they need to do. It's called The Speed of Trust by Stephen Covey Jr. Stephen Covey Sr. wrote The 7 Habits of Highly Effective People. His son, who went to Harvard Business School, was a very successful businessman. He says, the most important ingredient in my success is having my colleagues trust me. Nobody wants to do business with people they don't trust. When my investment advisor says, I can't understand it, I lose trust because he's putting himself in a position of power and authority and putting me down here. It's a bad dynamic now. And we have an advantage over patients. There are 3 people that have really advantages over people: the judge in the courtroom, the cop on the street, okay, because you can't really fight back with that, and the surgeon when they got a scalpel or a high-speed handpiece or a forceps in their hand. It's scary, man. It's scary there. And they got to go back like this, open their mouth, put you in close proximity, rip stuff out, and they got to pay for it, and then listen to you complain about your family at home and your vacation home and college expenses, whatever's going on in your own miserable life. Nobody wants that.
I tell my clients, Mike, that no matter how bad things are in the economy,
right?
Nobody out there cares that a dentist is doing it tough or a dentist has been ripped off. Don't tell anybody that you're going to get no sympathy because you're a dentist. The only time when we built our house in Sydney 25 years ago, I said to my wife, don't tell people what I do for a living because they'll charge more thinking that we make money. And so you just tell them the truth. And the truth is, what does your husband do? He works for the tax office because half of everything he earns goes to the tax office. So that's the truth.
That is true. That is true. Actually, I'll take it one step further, Dave. Nobody really cares about you, no matter who you are. Most people are thinking about one thing, themselves, And that's why when we go to our practice every day, we start every day. We start, it's showtime, and then there's another line which I haven't shared with you yet. It's called Be the Gift. I end every one of my YouTube videos on that because we're there to be the gift to our patients. We don't look at our practice as being a dental practice. We have somebody's job in a practice as their chief of hospitality. They're there to give everybody a good experience, whether they're a patient or employee. Today, one of my employees is getting married on February 14th. You celebrate Valentine's Day in Australia?
Yeah, we do. We do. We have electricity down here too.
Well, I mean, you don't have Halloween, so
we do now. That's invaded us, and Black Friday.
Oh, really?
Now we got Black Friday, biggest retail day of the year.
Well, we don't have Boxing Day. Do you have that?
Oh yeah, we've got Boxing Day.
You don't have that.
Yeah.
So anyway, there was a big party. I walk in this morning and there are hearts there and there's like fake champagne, ginger ale, toast. And there were heart-shaped cookies because she's getting married in a week and a half. And it was a big celebration and we posted it. And, everyone started giving speeches and there was a PowerPoint presentation. That's my chief of hospitality does that. So she also does that for patients. She looks for every new patient that comes in or every patient record. How can I make them happier? How can I give better customer service? And so we actually have a job for just giving customer service. It's our whole culture. So we say we're not a dental practice. We're a hospitality practice that just happens to do dentistry. So that's what we sell, dentistry, but we give hospitality. It changes everything completely around. And everyone's laughing. I went to a doctor's office yesterday and I saw a new doctor. I was looking for a subspecialist in this area. Everything's fine, but I just wanted to get a new doctor. And I heard this guy was good. And I went in there and they were friendly. It was a big office too. It was an office of probably about 20 doctors there. And everyone was friendly and they took me in and they apologized if their hand was cold as it took my blood pressure. And the doctor came in and he sat down. He goes, Mike, how can I help you? Hi, I'm Steve. And it was just a phenomenal. I'm thinking he's like, did he read my book? And I knew he was good, but he was just so personable. He goes, why are you seeing me? He goes, well, I saw your partner. He goes, what happened there? I said, I went back to him twice. And the second time I saw him, he didn't remember me from the first time, even though I had a long conversation about his shoes and his children and everything. And he didn't know what I did for a living. And, I refer patients to this practice. He goes, well, who are you? I said, I'm this. He goes, oh, you're Mike Sonick. You go, yeah. He goes, yeah, I referred to you, my assistant's husband. Goes, oh. We had a nice talk. It was open. It was great. And we started talking about all the people we knew. And he says, he's a Yale doctor. He goes, they want to move me up to New Haven where Yale is. He goes, I don't want to go. They want me to see more patients. He goes, I'm a local guy. I want to really connect with my patients. And he was phenomenal. And he answered every one of my questions. And he was just, he anticipated everything I needed to ask him. And I walked out of there and I turned to him as I left. I said, this was the best doctor's experience because I came from another doctor. Yesterday was Dr. Day. The best doctor's experience I've ever had. He goes, I really appreciate that. And I walk out, I go to the front desk and they have Valentine's hearts everywhere. Okay. It's already a week in advance and they're laughing and they're singing. And that never happens in a doctor's office. Usually it's like, can I help you? Just have a seat. There's a thing there. Payment is expected at the time of services. They did not put an anti-sales force in front of me. And, they take insurance, but they were in a good mood. They're doing something right there. And I think I know why. I think they've hired somebody for the institution to train them all. But that's the only office in that institution I've ever seen. It was a phenomenal experience. And you're about the sixth person I've told the story, and it only happened 24 hours ago. It makes a huge difference. It comes down to this, Dave. Be nice to people. That's it. Just be nice. Tell the truth is a good idea too. And be clinically competent and communicate well. Those are the important things. I mean, it's really easy, but it's hard.
Well,
it's not that easy to
got that story now, Mike, but I'm sure you've got other stories, as I do, of great customer service experiences where you think, I'm going to tell that forever and ever and ever. I remember eating in a restaurant in Florence where at the end of the meal, they said, would you like an after dinner drink? And I said, yeah, the Cointreau for my wife and a whiskey for me. And they brought a bottle of each and 2 glasses. And they just said, just drink what you want on the house. Yeah. They know I'm not going to fill it up. I'm not carrying a flask. I'm not going to steal it. And on the house. And I tell that story because really, in reality, the cost of what they give away, the advertising they get, you're only going to drink 1, maybe 2. And out of a bottle, it's a small price. And I've repeated that story so many times. One of my patients brought her daughter. And her daughter had a treatment, and she was a single parent, for whatever reason. And her daughter was 18, and then she said, "Now I'm bringing myself afterwards." And she had some considerable work, because of financial neglect. And we did that, but she kept coming to us to buy her Perioprox mouth rinse, Curacep. She would come to us. She would be in our office for an hour to buy the Curacep. She'd be bringing things that she made, food, photos, whatever, not to see me, but just that whole relationship. It was an expedition for her. And just that story if we hadn't treated her with respect as the parent of the daughter, and then treated her with respect as a human being and be interested in her, she would have just been a number and she would have moved on to somewhere else and maybe never found a dental home. And those stories really do, that's why we do it. People often accuse dentists of being too wealthy, but nobody wants to do the work that's involved anyway, for the rewards. But the personal rewards are far greater than the than the financial rewards, and who you become as opposed to how much you accumulate at the end of your life. Yes, you would probably be starting to think, you can't take it with you. It doesn't matter who's got the most stuff when you die. It's about the experiences and how you've been impactful on people.
Totally agree.
Before we go, and I know we've got to go because you've got a dinner, can you summarize the importance of health for the practitioner?
I think it's very important to be health-oriented. I look at ourselves as being professional athletes. And if you don't take care of your body, what we do is very physical. What you do just living a life is very physical. So if you don't look at yourself as being someone who's in good shape and take care of yourself with proper diet, exercise, meditation, prayer, whatever it is, to be mindful, get good sleep, then your body's going to break down. And I see that all the time, especially in our field. We develop all sorts of back issues and heart issues and stress issues, and not everybody really takes care of themselves. So I think it's really important. It's a big part of what I do. And I try to be a role model for my patients by getting them to be health oriented. And we talked about the importance of oral systemic link all the time. It's a big part of it. So when a new patient comes in, I talk to them about the importance of health, function, and aesthetics. That's always, we always talk about health. And that's actually one of our other 5 core values. Education is one, health is another one. So it's a big thing that we talked about.
It is important, and we could probably reconvene and talk about we should reconvene and talk about the systemic link, because I bet when you became a periodontist, it wasn't a topic of
No, it was
discussion at all. I remember a friend of mine who had a practice in the best street in Sydney, and he said to me, the mouth's separate to the body. And I'm going, really? He said, yeah, all the problems that people say that caused by their teeth, they're caused because they're a person and they're getting old anyway. But they are connected. The more that I've seen and read, even in my retirement clinically, about what the connection between gingivalis and dementia, these things are real.
Yeah, I can go into it a long time. Unfortunately, I don't have time to talk about that today.
Now, I appreciate your time today, Mike, and it's been great meeting you for the first time. And we do have a lot in common, although I've got a respect for periodontists. I do.
Okay.
But I thank you very much for your time, and thank you so much for being a guest on the Ultimate Dental Podcast. Tell me, for the notes, how can people get in touch with you if they want to find out more or learn from you, or have you come and speak for them?
Yeah, there's a bunch of ways. I have a website, which is my name. It's michaelsonick.com. You can email me at mike@michaelsonick.com. I have a video that comes out every Wednesday on YouTube. You can follow me at Michael Sonick there. I have an Instagram, LinkedIn. I put out a weekly newsletter. I have a podcast myself that puts out once a week. So I have so much stuff out there. I'm pretty easy to find. One of the recommendations I do have is follow the podcast or the weekly summaries. They're really good for your team to watch. My team watches them every Wednesday. They have a sandwich and they watch a 7-8 minute video. So it will start to bring your level of hospitality up. Read my book. At the end of every chapter, there's some suggestions and questions so that you know how you can review your own practice. I have a series of videos that will condense your team, be it people, not patients, practice, 10 modules and as a workbook. And that's really powerful stuff, but it takes some work to do that. And of course, I come and speak, and I do in-office, counseling and consulting and those type of things. But, anything to do with hospitality. Also, I teach other things too, but this is my true passion right now. This is the gift that I want to give. So thank you very much, Dave, for having me on the podcast. I don't know if you put all the stuff in the show notes, but hopefully you'll do that.
It'll be there.
Okay.
Thanks, Mike, and thanks for joining me today.
Thank you. It's been a true pleasure.
All right. Bye-bye.
Thank you for tuning in to another inspiring episode of the Ultimate Dental Podcast. We appreciate each and every one of you for being a part of our dental community and joining us each week on this incredible journey. If you found value in today's episode and you don't want to miss out on future episodes packed with expert insights and actionable strategies, here's how you can stay connected with us. Firstly, hit that subscribe button. Whether you're listening on your favorite podcast platform or watching on our website, subscribing ensures you'll never miss an episode. Secondly, share the love. If you know a fellow dentist or colleague who could benefit from the wisdom and knowledge that we share here, please share our podcast with them. Also, please share the podcast on your socials by simply clicking on the social icons wherever you view or listen to this podcast. Together, we can all do our bit to elevate the dental profession. And finally, stay engaged with us. We love hearing from you. Your questions, comments, and feedback fuel our mission to provide the best content for your professional growth, your personal growth, and for your practice growth. Remember, your journey to creating a dental practice and a business life that you love is our mission, and we're excited to be your trusted guide along the way. Thank you for being a part of the Ultimate Dental Podcast. Until next time, keep smiling, keep striving, and keep on tuning in to the Ultimate Dental Podcast.